Once a patient has been scheduled for surgery, what I'll typically do is I will mail the patient a welcome letter, and I have a RAC card that kind of gives a little bit of my background and what my role is here at the hospital. I do mail those to the patient. They have my contact information along with, a patient education video for them to view regarding their surgery. I will then call the patient after I have reviewed all of their orders and their notes from the physician's office. I call the patient, I see if they have any barriers at home, any comorbidities like cardiac or pulmonary issues, assist them with any appointments they may need, make the appointments for them so that they can be cleared for surgery. Typically, I'll find out if they have any stairs to get in and out of their home, how many steps they have, because I do like to communicate that to PT, so when PT does assess them, they work with them if they have. I had a patient recently with 18 steps to get into their home, to their room, so I made sure PT knew that, so they got extra work on the stairs. And I checked to see what DME they need to go home. DME is durable medical equipment, such as walkers, raised toilet seats. I'll go ahead and order everything they need and have it delivered to their home prior to surgery so it doesn't delay their care.